I initially wanted to be a pediatrician when I was younger, so I've always enjoyed the idea of working with kids. So then I went into college, actually started majoring in Spanish, and then I changed into elementary education and finally landed in human services, graduating and going into counseling. I think one of the experiences that really inspired me was personal experience with therapy while I was in college and feeling just incredibly supported during a challenging time in my life and wanting to kind of pay that back to others. My role at Reedsburg Area Medical Center is licensed professional counselor, and I work with primarily children and adolescents as well as their caregivers. Typically when I do that work, it is work with the child and a caregiver. We know that the birth to 5 years is such a crucial part of development for a child's brain, and we also know that the relationship that children have with the caregiver heavily influences brain development. So a lot of the work that I do with that young of children and their caregivers is about strengthening the attachment and the relationship and helping caregivers kind of understand their little kids. And then I also do work with adolescents as well as caregivers. Being a parent is incredibly challenging, no matter how old your child is. And just as much as I'm there to support children and teens, I'm also there to help out the caregivers in learning how to respond to their children in hard times or just any time, and learning how to support them throughout the different parts of development. The most rewarding thing about my career is probably seeing children, teens, and even caregivers becoming more confident and secure in themselves and in their relationships, whether it's a really small child who believes that they can finally do something they've been trying to do for so long, or they become more confident in verbally or non-verbally expressing their feelings and needs. With a teen, maybe it's how they find themselves and discover their identity. And with caregivers, it's really rewarding to see them become more confident, especially in learning how to set firm but supportive and caring boundaries with their child, and just feeling more confident as a parent. I came to RAMC because my husband and I are both from big cities, and we settled here a while ago and just love the community. We have a lot of connections with friends, and it's just enjoying knowing our neighbors. And then I saw that the mental health, behavioral health unit at RAMC was expanding, and I thought it would just be a perfect fit. I think what I love about Reedsburg Area Medical Center is the idea that I can just walk down the hall and talk to the doctor of one of my clients, so we can really create kind of a team around the individual and the family. In my spare time, I really love to spend time with my family, my husband and my son. My husband is the soccer coach also over at the high school, so we're attending a lot of soccer games, either locally, or we like to go to Madison and support their soccer team there, the Flamingos. We also enjoy, when and if we can, we like going to national parks and doing some hiking and just being outside. I really enjoy reading. I also really like to take my 2 golden doodles for walks. More so, they're the ones walking me, so you'll probably see us, me and them, walking throughout the neighborhood taking a stroll.